Hello everyone, my name is Vinay. Welcome to my channel LifeLore. Today we are going to discuss about hemostasis. What is hemostasis? Hemostasis is hem means blood, stasis means stop. So that is, in simple word, it is called blood clot. Actually, this blood clot happens in normal condition, but when this blood clot happens in disease condition, that is called thrombus. So this is the difference between blood clot and thrombus. Thrombus is in disease condition, but blood clot happens normally. This blood clot cascade a little complicated, so I will make this video in different parts. So you need to finish these parts if you do not understand in some point, but do not stop this. Continue and finish all the videos, and then watch it again to complete your understanding. For blood clot formation or hemostasis, what are the components we need? We need, for this first component is platelet. Second, endothelial cell. Third, plasma. Fourth, plasma proteins, which is fibrinogen. Fifth, several clotting factors. So we will see where are these factors present in blood. First thing is platelet. This is platelet. Where does it come from? If you have seen my previous videos in hematopoiesis, this platelet is derived from megakaryocytes. This is megakaryocyte, and the platelet is derived from the cytoplasm of megakaryocyte. This is not a cell, this is a fragment of megakaryocyte, which is derived from its cytoplasm. And this megakaryocyte is present in bone marrow. From bone marrow, it comes to the blood. What is the component and structure of platelet? Platelet has membrane which is similar to the smooth endoplasmic reticulum of megakaryocyte. And this membrane contains several receptors. The important receptors which are needed for this cascade are: first one, glycoprotein receptors, GP1B. Second, GP glycoprotein 2B. And the third one, GP glycoprotein 6. So these three are important glycoprotein or receptors present on platelet. Apart from this, what else does it have? Inside it contains microtubules, which make its constant shape, like a discoid shape. Apart from microtubule, what is there inside? Granules. One is dense granule, which is also called as delta granule. We'll talk about what are the components of delta granule. And another one is alpha granule, We will also see what are the components of alpha granule. This is the basic components of one platelet. And what else we need? Endothelial cell. The lining of blood vessel is endothelial cell. These are the endothelial cells. Inner lining of blood vessel. Endothelial cell. And surrounding this endothelial cell, there are some sub-endothelial cells and also extracellular matrix. These extracellular matrix are composed of collagens, which are also important for blood clot. What else do we need? Plasma. So like last time I said about plasma. What is the plasma? The liquid part of blood is called plasma. So plasma is everywhere in this blood vessel. And what else? Plasma protein, fibrinogen. Fibrinogen is secreted from liver. So this is a liver. The fibrinogen is secreted from liver and present everywhere in the blood. Apart from this fibrinogen, we need clotting factors. All the clotting factors are present in blood and they are derived from similarly from liver. Clotting factors and fibrinogen. Everything which we need for clotting are already present in blood. So the question is why they are not getting clot, they are not forming the clot. So when we know that why we do not have the clot in normal condition, we will understand how the clotting happens. First thing we need to know why there is no clotting in normal condition. When these platelets are derived from megakaryocytes, they present as inactive. Who makes them inactive? These endothelial cells, they always secrete nitric oxide, NO. What else they secrete? They also secrete prostacyclin, PGI2. This is called prostacyclin. What else? These also secrete ADP T phosphatase, which inhibits ADP. These are the components inhibit platelet, and these components bind to their receptor and make their receptor inactive. What else? And what happens to these fibrinogen and other clotting factors? We'll see. There is a molecule which is called heparin, which is present on endothelial cells. These heparins bind to antithrombin. This binding of heparin to antithrombin makes the antithrombin active. So this antithrombin will inhibit thrombin. As the name says, this is antithrombin, so it will inhibit thrombin. Apart from thrombin, this will also inhibit factor 10, factor 11, factor 12, and also factor 9. This antithrombin break down all these active forms of these factors and inhibit them. That is why these are in the inactive form in the blood. Apart from this, these endothelial cells also express some important factors which is called thrombomodulin. So this, as the name says, this thrombomodulin will change the thrombin will change the action of thrombin. So when this thrombomodulin will bind to thrombin, this is thrombin, and this thrombin will activate protein C, and this protein C along with protein S, these two will inhibit factor 5 and also factor 8. That is why these factors are present in the blood as inactive forms. And also, you can see this platelet is found as inactive. You can say all these factors are present in blood as a sleeping. They are not active, they are sleeping. And there is another factor which is secreted from endothelial cell, that is called TPA, tissue plasminogen activator. This is secreted from endothelial cell. What does it do? This will activate plasminogen to plasmin, and this plasmin will degrade fibrin to its degraded form. So this will, if there are some fibrins present in the blood, this plasmin will degrade those fibrins. This is called fibrinolysis. We will see this in the later stage also. So these are the components in the blood which keep the blood going and inhibit these clotting factors from clotting.